It's been 3 weeks since surgery, and let's see, yeah, 3 weeks. And since, my last video, the things that's been happening with healing, there's several things that comes to mind. One is the medicated stuff I have to use is working, like both medicated stuff. And I've noticed around the vaginal canal how they say like that sleuthing. It's basically the layer of skin. Basically, the medicated stuff helps to flush that out because it's like pretty much it's like dead skin that's coming detached from the vaginal canal, and it just takes a while for all of it to detach and come out. And it's been more of it's just been coming out recently, which is kind of weird. But since it's been coming out, when I checked everything, it actually, the way the inside of the vaginal canal looks, just looks normal. Like, the best way I can describe it is if you look on the inside of your cheeks, like the inside of your mouth, the way your cheeks look, that's how it looks. The coloring and texture and everything. So, and yes, I'm still having drainage at 3 weeks. And I've been, well, the urologist wanted me to try using the blue dilator at the second size up at least once before my appointment tomorrow. But I've tried it several times. But because I have a narrow pelvis, it's kind of, and plus the stitches that's at the vaginal entrance next to the perineum, it makes it a little bit difficult because they're dissolving stitches, but they haven't fully dissolved yet. So it's kind of difficult. Like when it tries to stretch out, it's a little uncomfortable at times. So, but I'm finding the second dilator, it actually, as things continue to heal, it feels better in terms of like the circumference, filling everything up. Feels better than the purple one, the small size, which I don't know, that's just how I feel. I can't say on anyone else's experience but mine. So yeah, there's that. And I've been noticing the stitches, where the stitches have been dissolving. It's been bleeding a little bit more in those spots. And yeah, and right now, the way everything is healing, as the swelling's going down, there's still spots that are still swollen, but I have asymmetry where my labia minora on the right side is just perfect, but my labia minora on the left side is where the asymmetry is. It's like next to the vaginal canal. It's kind of gone down in that one spot because how it goes down and tapers, hits the perineum. Well, that part on the left side has gone down. So I may have to have a revision to correct that so it's even with the right side. It sucks, but we just have to see how things go. And the other thing that's been happening as all the feelings have come back, well, how I mentioned in one of my older videos, how my spontaneous orgasms are. When I went off of bicalutamide, how it significantly dropped off. Well, since everything's been healing and I'm getting feeling back, they started increasing again. So I'm having spontaneous orgasms. And I noticed when I have too many, like in the past, it becomes overwhelming for the body. But I just have mixed feelings with it at times, like I've had in the past. It sucks, but at least I have orgasms. Some people don't after surgery, but from what I've heard, if you can orgasm before surgery, you can orgasm after. And I've noticed dilating has triggered some orgasms as well, which is a good thing. But the most irritating part is my fluid sexuality, because it's wanting one thing and I feel another. It's like how it fluidly changes throughout the month, how I'm wanting that intimacy, like sexual or non-sexual, but right now it's more sexual. It's what's going on. It's like my body's really feeling it. My body's really wanting it. As more feeling and things heal, my body just like it's really giving me the signals that it's really craving it. Not just like having a dilator in there, but the actual having it stimulated is what my body's wanting, which I can't do yet. Which in turn, what's happening, because I can't do anything about it when I feel it. Because when, like in the past, when I feel it or feel like an orgasm is going to happen and I don't do anything to relieve it, then spontaneous orgasms trigger. That's what's happening now, which is frustrating because my body's really wanting it in different ways. Even though it's like my body's wanting it one way, but personally, I don't want it that way, which kind of sucks. It's like my body's craving the real thing inside of me, but I hate penises. I hate male genitalia that way. Just, I don't like it, but my body wants it that way. And it's just like it's a conflict I deal with because my fluid sexuality, how it changes. It sucks. I hate it when it does that because I'm not comfortable that way. Like having it that way. As a lesbian with a fluid sexuality, it's difficult when the fluids and that fluidity just still on the female side. It hasn't switched. It's just within the construct of the female side. It's just wanting it in different ways. Like sometimes my body's wanting clitoral stimulation. I can't do that. Or just vaginal stimulation. I can't do that. Even though I dilate twice a day, that's not helping because it's just with the dilator in there, you're just holding it against the back of the vaginal canal when you feel the pressure. And because there's not real stimulation going on, That's where part of the issue is right now. And I just don't know what to do about it. But overall, how I'm feeling emotionally, I'm still happy I have the surgery. Even though there's asymmetry, I'm happy it's not malstructured anymore, because I'm having less dysphoria, a lot less gender dysphoria. Just like, just was thinking, and it's like the moment I woke up from surgery, it felt normal, and how it's healed, it just still feels normal, except for that little bit of asymmetry. Just it's off a little bit, but that can be fixed. Even though if I have to, don't want to have it done, but if I have to, I have to. So, yeah. And earlier today, before I took a shower, when I was looking in the mirror, I was like, it's like I'm having the same feelings like when my breasts got to a certain size. Like, I don't really remember what it like feels like having it the other way. It's like I don't remember, like, fully remember what it feels like not having breasts. It was like that, but now it's like with my genitalia. It's like because all the signals my body was giving me before surgery, and now it's like I don't really. It's like my body doesn't know what it felt like, remembers how it felt before compared to now. It's like, so it just feels normal. And how the other parts are like healing, well, still mostly feeling burning on the right side, then a little bit on the left side. And see here. And when the nerves reconnect, there's been times where it was worse than other times. And because those like electrical like shocks when it reconnects, what happened was I felt it internally, like vaginally, which was very uncomfortable, but worth it. Yeah. Other than that, I'm just dealing with it as it comes up. And just what I've been feeling is the right side has complete feeling, but the left side, it's like I can feel like temperature difference, but it doesn't feel like, it's kind of like that numbness without it being numb. Kind of like that. And I know certain positions makes it better than other positions as things heal. Because some positions are more uncomfortable than others. So, and it's just one step at a time as the feelings start coming back even more and nerves reconnect. So, and when I do feel it on the left side, because I don't feel it as often on the left side, it feels worse, but because I feel on the right side more, it doesn't feel as bad on the right side. So the worst I was having was the right side on the labia majora, the upper part of it, where when the stitches still dissolving, it was bad in that one spot. And yeah, and there's other spots I've been noticing when stitches fully dissolve. And that one spot where it's fully dissolved, it's bleeding a little bit. So around the glitter and hood. So the new spot I'm noticing. But that's just my experience, how mine's healing. And there's still drainage. I've noticed the drainage is starting to fill. How can I explain it? Like a warm liquid. Like a thicker liquid. Is it thick? Yeah. Like a thicker fluid that's kind of like liquid. Not like really thin, but not hugely thick. Just like a little more thicker than thin. Like liquid. Like fluid. Which feels different. But feels normal at the same time, which is weird. But I'm happy with it all. And with the hormone difference, I've been noticing fullness in my face. Yep, more fullness within my face, I've noticed. I just wish right through here there'd be more fullness in this area. Through here. But it is what it is because the bone structures you can see through here. Because I've been noticing that's been fuller since surgery. This whole area through here. It's the bone structure I've noticed. And more fat in my cheeks here, I've noticed. And yeah. And there's one thing that's coming to mind right now. I don't know if I want to mention it. Because it's something personal that family doesn't know about. All I can say is, if you know what little space is, I keep like mentally, like just at random times, I keep slipping into it really easily. Just it happens. And I don't know why it's happening, but it just does. As a little, it's just like, just been slipping into it for a short time. A lot easier than it has in the past. It's weird. Since surgery, and it was only this last week or so it's been doing that. It's been happening with me. It is what it is. But other than that, I don't want to talk about that any further. So this is kind of personal for me. But overall, happy and not having that conflict with things like I did before. Because how before, when it was structured mail and would feel the testes pop in or out from being tucked, caused a lot of dysphoria. And now, not having them, that dysphoria is just gone. It's like completely gone. I've noticed it's just getting better. Just as things keep healing, it just seems like it's getting better and better. And just waiting to see if I end up having new dysphorias. Like when one thing goes away and other things come up. Most of it is just what's been coming up is some emotions that's hard to identify at times. So, yeah. But overall, the words from my girlfriend, she says, she noticed I'm a lot happier and not having that issue anymore. It's just like it's not there. She's noticed like that happiness is not. So, yeah. And been thankful she's in my life because it's been a big help. Especially when being released from the hospital that first week. Yeah, was a big help. Even now it's worth it. Worth it. So worth it. So, the only other thing I'm noticing is my hormone cycle. How that works after surgery. Because if you experience it before, where you get the cramps and bloating and all that, it could still happen afterwards, or it may not happen. But because of the hormone difference, not having certain parts, it's kind of not as normal as it could be at the moment, because it can take a while for the hormones to renormalize, because it can take up to 3 months. So it's like when my hormones were changed at the beginning of the year, how it was off a little bit, and like the end of last year, the beginning of this year, when things were switched around, how it was off, then it became normal again. That's kind of like what it feels like now. Which, been having the bloating, but not really much of the cramps. I've noticed this month. So, yeah. But at least I'm still having a hormone cycle for the most part, even though it's not 100% where it was before. It's still happening. And the cramps I have felt has just been so mild. It's just like, yeah, almost non existent of the hormone cramps. Not the other kind with the hormones. So, and at times, it's just really hard to like believe that. It's like, just woke up from surgery and it was just all female, and it felt like it was there all along. Like I was born with it that way. And it's just amazing how you're able to do this kind of a surgery successfully the way they've done it for me. And it feels right, feels normal. And if you hear the noise out there, sorry. It's my girlfriend's in a meeting. But I'm so happy that there's times where I just want to cry. And it just, a lot of times it's just been hard for me to let myself just cry. Like I look in the mirror now and it just feels all normal. I just feel like crying, like tears of happiness, relief, and joy. That it feels right and it feels normal. So it's like right now how I'm feeling. I just feel like crying a little bit. But my body's just like not letting me 100% just let it out. But all in all, I'm thankful I was able to just have the surgery and have supportive people along this journey of mine, especially at this moment in my life, because that was a struggle. Yeah, because that was a struggle until I got a girlfriend with all the irritating things from men that was happening, that's not happening anymore. Well, at the moment, like the last 3 weeks, 4 weeks or so, it hasn't been happening, like men hitting on me and whatnot. So I'm thankful that my girlfriend's in my life, because ever since that's happened, I haven't really gotten men coming after me with all this and since surgery and all and whatnot. So that's a good thing. But all in all, it's worth it in the end. Everything that led up to this moment in time where I've had surgery and healing from it, still healing from it. Everything I struggled through and went through, all the pain feelings and emotions I've experienced, um, the difficult times I've dealt with myself, and all the way up to all the happy moments as things changed. And one thing that's just came to mind, this last thing I want to mention is even after I've had surgery, um, transition's really not over. It's not, because if you really think about it, transition never really is over, even after all the physical changes and surgeries and whatnot. You're still going to be changing throughout your life, because you're always going to be changing all the time, even if it's good or bad. So transition's really not over. So that's a big thought and something to think about when you're going through all this. So just remember, transition's really not over, even if you have surgery and all the physical changes are done, because you're always changing all the time. And for me, I'm just happy where everything is right now, within my transition and in my life right now. I'm just waiting till that moment where it's healed enough so I can do more stuff, because right now there's not much I can really do, because I can't do anything that puts stress or strain on the pelvic floor. Like if you lift something that's certain pounds or certain positions you can get in, or just certain physical activities puts like stress or strain in the pelvic floor and down there where all the stitches are. So can't wait until that day where I can actually do more, because they don't want me doing much physical activity right now, which is not a bad thing, but I just wish I could do more. Yeah. Well, all in all, I'm happy. Happy. This is like, I remember when my breast became an A cup and I was happy. Then as my breasts continued growing, I was happy. Then when they got to where they're the size they are now, and that dysphoria just went away, I was like, it's like how I'm feeling now with my genitalia. I'm happy. That dysphoria is just gone. It was just like instantly gone. The moment I woke up from surgery, it was just gone. I haven't had dysphoria about down there since that moment. That split second when you wake up, it was just, the mind body connection was just instantly there. And just been really happy since, even though I just have emotions that's going up and down and just all over the place at times. I'm happy. It was worth it. I'm happy with my decision of going to the University of Utah and having Dr. W.A. Goodwin. It was Dr. Goodwin who did my surgery. I'm happy with that decision, even though I've mentioned in older videos how I was feeling, who I wanted to go to, and how I was feeling at that time, because things change over time. So I'm happy with it all. and it just worked out perfectly, except for that little asymmetry, which can be fixed. It's not like a huge major surgical fix. I just have to wait about, I think it said 6 months before I could have a revision done to make sure like all the swelling and everything is down, to see, yeah, which the skin is still there. It's just the best way I can describe it is on that left side next to the vaginal canal. Instead of it's instead of being more prominent sticking out, it's like it's deflated. Like the skin, that spot where the skin is deflated. It's the best way I can describe it. It's like they need to inflate it again and make it even. That's pretty much the best way I can describe it. But other than that, I'm happy that it's not male genitalia, that it's all female, and that dysphoria is just gone. It's just a big, huge, giant relief. Even though my body wants certain things I can't have right now, I'm still happy. Especially how things are looking, because it's unique and uniquely, individually to my body. And that's what's good. And yeah, other than that, just happy with everything. Hopefully my hormone levels are normal and my estrogen's not still too high. But other than that, where everything's at, feels like my body's just going through a little bit of physical changes based on hormones, like I mentioned, in my face. And I noticed in the tummy area a little bit there has filled back in. And hopefully I'm able to gain my 4 pounds back. Because when I had surgery, what happened was, no, it was at the beginning of the year, my hormones were switched. I lost 4 pounds. The whole issue I had. Um, then when I had surgery, being in the hospital, I lost 4 pounds. So I went from 118 down to 114. I gained that back. So last I was checked, I was 118 pounds. I'm hoping I'm able to gain the 4 pounds back that I lost at the beginning of the year from the hormone difference and everything changing. I'm hoping to gain back to 122 pounds, because when I was 122 pounds, I just felt comfortable and right. And I was happy with my weight there, even though I've been trying to gain to 130 pounds just for the fullness of my breasts, the help of that. But I can't pick and choose where the weight's gonna go. But it does feel like my breasts are fuller since having surgery. I just had one uncomfortable spot once. It was on the right breast. But other than that, haven't noticed like they're really growing, but I know the fullness is a little bit more. Which, the bigger and fuller they get, the happier I am, and less dysphoria, which I don't have dysphoria from that area anymore. And it just feels normal. So, yeah, that's a lot to go through. And if you stuck through this video this long, thank you for watching. I just had to say what I had to say. So, much what's been going on, thoughts and feelings, what my body's going through. And yeah, even though at times it's uncomfortable, especially when the nerves reconnect and I feel the electrical like shocks. Sometimes it's been really small ones, like a bunch of small ones. It's like it's really prickly all at once. It's like moving. You can feel like prickliness going like, eh. And I felt that surrounding where the clitoris and the hood meets together. That's where I was feeling it like that, and it was just weird. So you can have like pain, discomfort, burning, like prickliness or tingliness, like big ones or really tiny ones, or like electrical shocks or just hits like that. And sometimes I notice when those electrical shocks, like when the nerves reconnect and it just hits, it makes parts of my body just jerk. So, yeah. Other than that, I'm happy it's not male genitalia. And as the swelling goes down, peeing has been interesting still. Sometimes it just, as it comes out, it's like a straight shot and it comes out, and sometimes it's all over the place, but it's getting better where it's because normal is when you pee and it just goes straight out without going all over the place. But sometimes if it goes all over the place, it's because the labias are together. And you just have to pull them apart a little bit enough. Yeah, from what I've learned in the past before I had surgery. So, yeah, even though my labia minora is prominent, and I'm waiting for as much swelling to go down and whatnot. Um, just can't wait to experiment with underwear and like pants and other clothing just to see what's going to work and what's not based on my anatomy down there. So, yeah, which I'm happy with it. So I just have to find out what works and what doesn't. And if it stays prominent, then it does have bigger labia minora. And that's okay. Even if you're cisgender and you have huge labias, it's okay. Don't listen to anyone what they say. They make fun of you because of it. Or the stigma, what's normal and what isn't. Because female genitalia isn't all like a cookie cutter pattern. Like it's not all the same. It's all going to be different. So just be happy with what you have, no matter what you're born with, or if you had surgery and how it's healed. Just as long as it's not causing a lot of pain and discomfort, then you should be okay. Just I know it's hard, but being happy is just a wonderful feeling. It's just a wonderful feeling and relief with it all. And all I can say is just don't give up. It's hard, really hard at times, and struggle at times. It's just don't give up and just try to find like minded people to be in your life and um, and just do your best to be you, the best you can be, no matter what that is. And in the end, it can be worth it. It'll be worth it. Just wanted to just say those words of encouragement because it's so just like worth it. Life is so precious and worth it to never give up on yourself and to have that joy and happiness with others. So, until my next video, please comment. I want to hear your comments. Like, if you have any questions that I've never answered, please. So, yeah, please comment, rate, but give me a thumbs up and subscribe if you haven't, if you like my videos. Other than that, stay happy until my next video.